And now I request Daniel Mont, CEO and co-founder of Center for Inclusive Policy, to talk to us about the inclusive model of social protection policies for persons with disabilities. He has extensive experience in the area of disability and inclusive development. He was a senior economist with the World Bank and a principal analyst with the US Congressional Budget Office, and has worked with a wide range of other international development agencies, governments, and civil society organizations. He served as the chair of analytical working group of the UN Statistical Commission's Washington Group on Disability Statistics and worked with UNICEF and UNESCO. Over to you, Daniel.
Hello, everyone.
And you have 10 minutes.
Hello, everyone. And I can share my screen, right? Okay, and you can see that okay?
Go on slide. Yes, yes.
Okay. Okay, hello, everyone. I'm going to talk today about what do we mean by an inclusive model of social protection for people with disabilities. So what is inclusive social protection? First of all, it's not a charity model. It's not a model where we simply target a national poverty line and make sure that we give money to people with disabilities so that their households are above some set poverty line. No, inclusive social protection involves supporting participation by providing those needed supports for people to have opportunities equal to people without disabilities. And if we're going to do that, one of the first things we have to do is assess who has a disability, who qualifies potentially for a disability, and what kind of information do we need about people in order to build inclusive social protection. Well, when we do those assessments, the first thing we have to be sure of is that they're easily accessible, that they're free for everybody, they're available everywhere in the country, they're accessible in terms of physical accessibility, as well as informational accessibility. They need to be comprehensive. When we assess people for disability in light of social protection programs, we're not just looking at what are their functional limitations, what are their medical diagnoses. No, we need to go beyond that and include what are their support needs, right? What are the things they need in order to be able to participate? That should be part of the assessment. And by being comprehensive, it needs to be inclusive. All people with disabilities, age appropriate. Children and adults need different, and elderly people need different types of supports, as well as gender sensitivity and respecting privacy and dignity. And finally, the third component of an inclusive assessment has to be reliable. We have to limit both fraud, and because there is fraud, we have to acknowledge that, and complaints when the system isn't working. So it has to be accountable, responsive, and transparent. People have to understand how the assessment works and what's going on so that they can hold people giving it accountable to the way they should be doing it. It needs to be participatory, involve organizations of people with disabilities, and it has to work across ministries, across silos. And another thing that's important with inclusive social protection is moving away from the notion that disability is the incapacity to work. Okay, we're trying to promote the employment of people with disabilities. So we don't want social protection policies where people qualify for them because they're seen as not being able to work because they have a disability. That's completely contradictory to the CRPD. So we want to shift away from, oh, disability means I can't work, therefore I get social protection policies, to social protection policies need to be able to put people in a position where they can work. They can overcome barriers and lack of supports in their environment. That's the role of social protection. Another thing when crafting social protection benefits that's important is accounting for the extra costs of living with a disability. People with disabilities face extra costs of living. Those could be general items like food and transportation, medical care that all people have. But it could also be disability-specific items like assistive technology, for example, hearing aids or wheelchairs or things like that. Both of those things add to the cost of living. If I have two households that have the same level of income as in this diagram here, the blue household and the orange household both have the same level of income. but the orange household has a person with a disability. They have these extra costs. Once they pay for those extra costs, their actual standard of living is lower than the household without a person with a disability. Social protection policies have to account for this in order to equalize outcomes. They have to account for it in determining who is eligible for social protection benefits, and also what kind of benefits are being given. In order to do that, in order to build inclusive social protection policies that adequately address those extra costs of living, we have to be able to measure and assess those extra costs. And that could be difficult, although work is being done right now in a number of countries where we're making real progress in being able to measure those costs. When we start looking at them, we find out that they vary dramatically from person to person, based on the type of disability and also based on the degree of disability, right? So in this data here, which is up here from New Zealand, we can see that people with high mental health needs have extremely high extra costs. People with moderate mental health needs don't have very extensive extra costs. People with physical high needs also have high extra costs. So, and then if we look at where those costs come into play, what are those costs? We see again, they vary by type of person, by type of disability. So a big chunk of those extra costs are in support, and this is in New Zealand, are in support services. But if we look down at physical, we see that equipment, assistive technology, and transportation costs are a relatively bigger chunk where they're not for, say, people with mental health needs. So what does this mean? Because costs vary a lot by type and degree of disability, a one-size-fits-all cash top-up will not work. A number of countries are doing this, considering it, saying, oh, okay, people with disabilities have extra costs, so we're going to give them X% more cash benefits to cover those extra costs. But those costs vary a lot by type and degree of disability, so it's not going to be enough for some, maybe too much for others. I doubt it would be too much, given how modest these programs usually are. They also vary a lot by local context. Okay, a particular good in a city may cost a different amount than in a rural area. Costs also depend on participation. If I want to go to work, the costs of disability go up. If I'm just sitting at home with my family all day doing nothing, the extra costs of just being able to survive as a person with a disability in my home may not be that large. If I want to go out into the world, I want to go to school, I want to go to work, I want to go to community events, I'm going to have to spend more in order to participate. And costs are not always incurred in a uniform monthly manner, right? Social protection benefits, oh, you might get whatever, $25 a month, but your costs don't come in at $25 a month. If I have to buy a wheelchair, that's a huge cost at one point in time that has to be, that's spread out over very many months. So if I build a social protection program that just gives me a little extra money every month, it's not going to meet the structure of how those costs are incurred by people with disabilities. So we need to build those social protection programs in a way that addresses the way that costs are actually incurred and how they're being spent on. And so we need to determine people's support needs. Disabilities assessments can support inclusion by determining those needs. Countries are trying to develop that. For example, in the Philippines, they're working on a disability assessment that includes determining, what are those extra needs. Kenya has a big support services survey that's in the field. Countries are also working to determine the extra costs of needed for participation. For example, in Georgia, in South Africa, Peru, Kenya, Bangladesh, and all of these countries, empirical work has gone on that I don't have time to go into here to try to sort of nail down what are those costs and how that can help us figure out how we want to determine social protection policy. So the big takeaways are, one, social protection policies should promote inclusion, not just alleviate poverty, right? Number two, disability assessments must be accessible, comprehensive, and reliable. disability should not be equated with the ability to work. And social protection policies need to address the extra costs of disability. But to address those extra costs, we need to determine support needs, because that one size fits all top up is not going to work. So thank you. I went through that very fast. I only had 10 minutes. There's a lot of stuff written out there and resources that go into this in more detail, but hopefully that gives you a taste of a framework of how we need to start thinking about building social protection that's inclusive, and it is not sort of a charity-based idea of providing support. So thank you very much.